We're going to talk about what we've been talking about, which is what we're going to talk about.
That is what we're going to talk about.
Which is what?
What we're going to talk about.
Can we talk about what we're going to talk about?
Does anybody remember what we're going to talk about? Anyone? Anyone there yet?
Inflections?
No.
Was it an English thing?
This month, we have been
that's right.
discussing home remedies.
Yes.
Home remedies, folks.
DIY. Do it yourself.
That is right.
Yeah.
That is right.
Hey, Tim.
All right. I gotta share our stuff here, so I'll let you talk a little bit.
Oh, well, that's nice of you.
Yeah.
All right.
I'm the one that's really in charge.
So,
What?
I didn't say anything. I had an infection in my neck. So we're talking about infections this week, and that's Newman.
Yeah. Hi, Newman. Thank you, Newman, for all your support.
You know how distracting that is, Newman? I'm always like...
Hearts.
All right. So today we're talking about infections and kind of natural remedies. And with that, some of the hardest parts about this topic isn't what can you do, it's trying to figure out how to limit all the things that you can do. So there's something like, I think, 4 million natural remedies for things like infections. And so then you're trying to narrow that down into what would work for the average flu or, you know, a bacterial infection or a wound or something like that. So if you guys have questions or concerns, infections...
Yes, please, can you... I'm going to jump in here.
All right.
What infections... We're going to get vulnerable here. This is like a support group.
Yeah.
If you feel comfortable enough, tell us what infections you are struggling with now or you have struggled with in the past and have had, or you just have chronic issues with. Tell us what those are. And then we will try to address them in the talk. Also, don't forget to share us so that people who don't know about us can get some good information too, get some help.
Yeah. If we get 1,000 views this week, I'll undo the top button. Right. Each week I undo it. No?
That's going to guarantee...
You don't think that'll help?
I think that'll give us...
oh, man.
5 views.
We might lose support. Okay, so a couple things. Is one, we already did that.
I see sinus.
Who?
Sinus. That's a good start. Sorry. Just keep that.
I thought the person's name was Sinus. Okay, Sinus.
Sinus. I see sinus. That's one.
So sinus, that's a pretty good one. Sinusitis. So a couple things about that is when you have sinuses in your head, or I guess if you do, no, everybody does. So everybody has these holes in their head that makes your head lighter. So your head already weighs 10 pounds, right? You got a big block of Jello up there and some bone. And to make that bone lighter, they have hollow spots called sinuses. And those sinuses then become spaces where you can get infections. And so it has to constantly drain through those sinuses to then take all the bacteria, viruses out, and then it drains down the back of your throat, all the way down your esophagus, and into your vat of acid, which is your stomach. How many cups of mucus should we make a day?
I'd rather not make any, to be honest.
No,
but
you have to
I think you told me this. I think it's 10.
Yeah, it's 10 cups. No, you have to have mucus.
I know, but just when you think about it, nobody wants to think about making 10 cups of mucus a day.
Think about that next time
you guys
want
to think about that?
Yeah. Right? 10 cups of mucus come from here and clean all the way down here to your stomach. Right? And so it grabs on or binds or sticky. It's like sticky fly tape back in the day, where stuff gets stuck to it and then it slides down into the acid. So you have a bony kind of like a chamber, and then you have a little tube, and then you have a bunch of mucus that's pouring down there. If that tube gets infected or irritated, it will then close on itself because it can't push the bone back, and then the fluid starts building up and it causes pressure, and we call that sinusitis.
Okay.
But that doesn't mean it's infected. So you can have sinus pain without an infection. But then if you have an infection in there, then that becomes a big problem. And so you want to fight that infection, normalize that tissue. And typically, about 90% of all upper respiratory infections are going to be viral, not bacterial. Right? So very, very rarely should you ever need an antibiotic, whether natural or synthetic.
Okay.
So the way viruses work in your body is... Yeah?
Sorry to interrupt again. I just want to address everybody who said something. Deb, I did see your UTI suggestion as well, so we'll get to that too. Newman, hi. Tammy, hi. Deb, hi. Thank you all of you who are joining you, and we'll try to continue addressing your needs as we go. Newman, we're looking forward to that T-shirt you're going to make for us. Okay, sorry.
All right.
Back to infections. I think you were getting ready to talk about viral.
All right, so I love how the body deals with viruses. It does. So there's three main parts to the immune system that fights viruses of infected cells. So like in your sinus, is one, there's interferons, and those block the entrances and exits to all the ports in and out of the cell. And then there's cytotoxic cells and natural killer cells. And those poison and kill your own cells that are infected. Well, I guess some that are not infected too around it, right? So, if you have, say, a rotavirus or a RNA virus or a cold virus or a flu virus or hundreds of different types of viruses that you can get sinusitis with, your body will then take and those interferons will block all the doors and windows to that cell that's infected, all the ones to the neighborhood around it, and the natural killer cells and interferons will go through and kill all those cells. So think about like this in real world terms. Let's say somebody broke in your house, right? And they're probably in your basement waiting for you to get home tonight.
Thanks for planting that seed.
Okay, so somebody breaks in your house and you call the cops. And the cops show up and they board all your windows up and all your doors up so the burglar can't get out. Then they go to all the neighbors' houses around that house and they board up all their windows and all their doors. And then they burn them all down. Guess how well crime would do, right? You just end crime like that, right?
And maybe humanity.
That's right. Somebody robs a bank, you just close up all the doors, burn the place down, right?
Just burn it.
So your immune system is really kick-ass when it comes to fighting viruses. So most times you're able to overcome that. But if you're not, then what do you want to amp up?
Somebody to help.
That's right. So you want those natural killer cells, those interferons, those cytotoxic cells, to just go crazy. And one of the best ways to do that, now there's tons of things that'll help, from echinacea to astragalus, but vitamin C is the simplest, easiest way to amp that up to knock out a sinus infection. But it has to be therapeutic dose. So some people take a little bit of, I think we're going to have a visitor here, just like Mr. Rogers' Neighborhood. We'll wait and see if this happens. So,
Okay.
The maid's coming by to clean the trash cans.
All right.
That's all right. We'll tell her.
I will take it.
We'll have her sit down as a guest.
I will play interference.
No, come on. We'll have her sit down as a guest.
No.
Yeah?
Okay. No.
Yeah.
I doubt she'd be comfortable with that.
So...
Ooh, eye infections. We got another one. So we have sinus, UTIs, and eye infections. We will get to your...
That sounds like my last date. All right. So... All right, so then if you take, and this is the protocol that I use myself, and I love this protocol because 99% of the time it always works. And so vitamin C at therapeutic doses will actually dramatically increase natural killer cells, interferons, cytotoxic cells, and they will just kick butt and knock the virus out. So you want to do, or especially for an adult, like 5,000 milligrams of vitamin C, but you want to use vitamin C with bioflavonoids, so you want to get it from the health food store. So this is one that, like, this is a simple one that I got that I keep at the office just in case.
Bioflavonoids. Why does it have to have bioflavonoids?
I've opened it too. So, all right. So, vitamin C. See, it has bioflavonoids. So, in nature, vitamin C is surrounded by bioflavonoids, and that's part of how it works. That's the magic.
Okay.
But what we do is we say, can we just synthesize like a part of that and sell it to people and legally call it vitamin C? And so that's what ascorbic acid is. Ascorbic acid is really just like a processed vitamin C that we create. So, if you get it with bioflavonoids, and 5,000 milligrams is a loading dose. And that shouldn't be enough to give you diarrhea, although just due to bowel tolerance, if you don't tolerate it very well in the beginning.
You can also get vitamin C that's easy on the stomach. Is that the same thing? Is that connected to diarrhea or just stomach upset?
That's just, yeah, it's because vitamin C is ascorbic acid.
Okay.
And so ascorbic acid is acidic and it kind of irritates people's stomachs sometimes.
Okay.
So then you do 1,000 milligrams of vitamin C per hour until it's gone while you're awake. And I have to say almost every single time, if I feel like, oh my God, I'm getting sick, that's what I do, and it always works. And if you take too much vitamin C, or take more than you need, you just feel awesome. So.
And whatever you don't need, you just pee out. Right?
Well, in most
so you can't really OD on it.
Right. Yeah.
I want to speak to this too because I'm always terrified of getting a respiratory infection. Always terrified of this because I've had such trouble figuring it out, healing it, getting better. And weeks and weeks and weeks would go by, starting with the virus, turning into whatever it turns into. Anyway, I have to give this guy credit.
Aww.
Just only one time tonight. But this guy credit because I started doing the vitamin C, and it's not just white noise.
Oh, hell yeah.
He is not just blowing smoke. But I was afraid before to take that much. But then actually listening to the doctor paid off. And I think within a day or two of just really focusing hardcore on just that, and some other things too, I was feeling better so much sooner than I have ever felt in the past, struggling with stuff like that.
Yeah. Well, I gotta say, when I used to get sick all the time, and I was always like trying to figure out what could I do, and as a guy, I want the simplest one thing fixes it kind of thing, and so I thought vitamin C was hype, and I think if you get junk vitamin C, like I've done it with crappy vitamin C from like I think Walmart or Dillon's or Walgreens or something, and it didn't do anything for me. I took a ton of that stuff; it did nothing, and then I lectured at Natural Grocers the next day. Got real vitamin C with bioflavonoids. Boom! That night it was all gone. That's
so
the only
quality
time
does make a difference.
Yeah, it really does. And like this is nature's way. It's pretty simple. I like.
It's not terribly expensive either to get the
right
nicer brands.
Yeah. So vitamin C is old school, always works kind of thing, right?
That's your first go-to. Is that what you would consider your first line of defense?
Right. Yeah.
Okay.
Because otherwise, you can do elderberry. Well, and one time, so. When we had our second child, Naomi, my wife was about to give birth, and I had the sniffles, and they said, you can't hold the baby if you got sniffles. And I was like, I'm holding my baby. So I went down to the health food store, and I was just like looking for one thing. What dramatic thing could I do and overdo? And so I actually went and got, I was like, I could do this, I could do this, I could do this, I could do this. But I got a big bottle, like a wine bottle full, of elderberry concentrate, so you're supposed to dilute it. I drank that whole bottle, and I went and had lunch, and then I went and held my baby, because I didn't have the sniffles by the time she was born.
Why do they say to dilute it?
They're weak. They want to ruin all the party. They want to ruin your fun.
So
You're supposed to dilute it with some vodka, right? And then you have a healthy party. Oh, right. Someone's liking that. See,
you're supposed to do the keg thing.
That's
with
right.
It. What is it?
Keg stand.
A keg stand with elderberry juice.
Yeah. So
what's the active ingredient in elderberry?
It's elder.
What's elder?
So so most foods. That's a good question, but most foods have tons of polyphenols and bioflavonoids and phytonutrients, and so it's that mix of just hundreds of bioactive chemicals that then help improve the immune system and all these different facets, right?
Okay.
So like something like garlic has 100 bioactive chemicals against virus, parasite, fungus, yeast. So the active ingredient isn't just allicin or now I'm going to forget it. Allicin, Allen, what's the other one? Allenol? Anyways, there's like 20 different, I guess there's 100 different bioactive ones. But when people buy garlic oil, they're buying one usually.
Okay.
Or they buy a supplement, they're usually getting 1 or 2 bioactive ingredients versus food.
So I have another question.
Yes.
So we talked about vitamin C. We were talking about sinus infections.
Mm-hmm.
Can you use vitamin C? Because we're going to talk about different types of infections tonight as well. Can you use vitamin C for everything across the board? Any kind of infection you have, can you start with vitamin C?
You can, because natural killer cells, interferons, cytotoxic cells, they kill bacteria.
So no matter what it is.
Yeah. But you know, that's funny, because I've never used vitamin C for bacterial infections, only for viral. But again, 90% of all infections are viral. So,
okay.
So for bacteria, I usually go with so if you're sinusitis, you think, usually what happens is it starts viral, ends up becoming bacterial, so then, they usually always give antibiotics for that. But if you do Paldarica or Golden Seal, those are very powerful antibiotics, and you can't do them more than 2 weeks, or Uva Ursi, more than 2 weeks, but they are really kick butt at killing bacteria.
These are all natural antibiotics.
Mm-hmm. Yeah. And there's literally just millions of these things, but a few hundred that we constantly prescribe in the U.S., and most people, it's hard because there's just hundreds of things that you can use. So I usually pick 5 or 6 things I really, really like to use.
I have a couple of things. I just want to say hi, Gina. Hi, Will. Hi, Nick. And Shauna, hello. Shauna has a question. How much vitamin C for kids?
Yeah, so, herbal, along with, medications, are dosed based off of usually 2,000 calorie diet, so like a 180-pound man, right? So even women should take, a lower dose of medication, but, medicine, it's all male-based. They don't care about anybody else, so everything's prescribed for a man, and then we don't dose it down for anybody else. But it should be based off weight, so the true, accurate prescriptions are based on milligrams per kilogram. So for kids, typically you just want to say, okay, compared to a grown man, is he half the size, quarter the size? And that's your general rule of thumb with that. And not all herbs can be used on kids, just like not all essential oils can be used on kids. But for things like vitamin C, I would probably cut the dose in half to a quarter, as long as you're getting therapeutic effect.
Okay.
Yeah, so we had a patient today, or yesterday I think, and my recommendation for the kid was 1,000 milligram loading dose, 500 milligrams per hour. So,
okay.
And luckily vitamin C, that's an extremely safe thing to use.
Yeah.
Yeah.
Yeah, that's a good start for sure.
So that's a great question.
Back on antibiotics, all natural antibiotics, which you mentioned previously. Will you throw your bacteria off overdoing that? Can you overdo all natural antibiotics?
All right, so are you talking about drug-resistant kind of ones, or
well, we just
your bacteria gets used to it or something?
From what I understand, we're supposed to be careful taking prescribed antibiotics.
Yeah.
Because of the effect it has on, because it kills everything.
Oh, okay. So, that's an interesting concept, because most bacteria have a very specific mechanism by which they evade the immune system. So, like penicillin, or I think it's penicillium is the actual bacteria. But, is that right? I think that's right. Oh, no, that's not right. I used to teach micro. Okay. Staph. We'll say staph. All right. So, Staphylococcus, all right? So it has a little capsule around it. And penicillium, that's right, penicillium is the active ingredient, and penicillin is the drug. But penicillium goes through and takes all the rivets out of the joints, and then that shell falls off, and then you can see that bacteria, and then you can fight that infection. Okay. And so what we do, so when you synthesize a antibiotic, you take one mechanism by which that will work, like that penicillium, and then you synthesize that, and it's static. You patent it, you can't change it, right? Nature's always evolving to fight each other, but once we create a drug, that's it. And so it only took 3 years to have drug resistance to penicillin. And it only took 11 years to create national resistance to that antibiotic. And that happens across the board for all antibiotics. And so then what it did was it took that capsule and added on little extra parts. So then the drug knocks down all the tails that are hanging off, and then that capsule's still there, and then that bacteria is now surviving the antibiotic. Yeah. Okay. And then we just create another antibiotic which deals with another mechanism, another one, right? So with nature, most of these antibiotics that we do aren't going to kill off bad bacteria, but more of overgrowth of good bacteria and overgrowth of bad bacteria because of the mechanisms that they use for that infection.
So it creates more of a balance.
Right.
Okay.
Right. And that's where food should be your main source of antibiotics, because it's constantly knocking down any infection or overgrowth, so you don't have to deal with it.
So safer. Yeah.
The only exception really to that I know of is colloidal silver. Because colloidal silver is a wide spectrum antibiotic. It sterilizes everything. It kills everything. And so people that do colloidal silver as preventative are probably doing more harm than benefit. That's for sure.
Okay.
Yeah. And then if you make your own and you make it way too strong, it'll turn you blue. Did you know that?
That's what I have always wanted.
Well, that's where Smurfs came from. Did you see that blue guy on Jesse Raphael back in the day?
No.
The dude's a Smurf. He even has a beard like Papa Smurf.
Did he tattoo himself blue?
No. It's too much silver.
Oh, it was a colloidal silver case?
Yeah, okay. He said, it's that kind of idea like more is better, so. Oh. Okay. So he made stronger and stronger colloidal silver, and then he turned himself permanently blue forever.
Oh my gosh. Let's not do that. Hi, Rachel. Always glad to have you. So we talked about sinus.
Yeah.
We also had another person who asked about UTIs.
Yeah. So, I learned in microbiology something called germ theory. And germ theory says germs cause disease, right? And in UTIs, it's E. coli, which is your gut bacteria, which basically for women get more UTIs, guys rarely get it. But that's because the entrance to the rectum is here, and then the entrance to the vagina is here, and then the urethra for the bladder is here, right? And I just want to make jokes about that, but I'm not going to. So, if the bacteria goes across, like when someone's sweating or something, and then it inoculates and it goes up into the urethra, then you can get a urinary tract infection. However, so in school the answer was E. coli from the butt causes urinary tract infections. So exposure to the bacteria causes it. But then I had 4 daughters.
Right, and go ahead. Yeah, I have thought on this too.
All right, so 4 daughters, and I had to clean poop out of their vajayjays. And all I could think about the whole time was, why aren't they having infections? Why don't the babies have constant UTIs if they're constantly being exposed to E. coli bacteria that causes it? Mm-hmm. Yeah. Mm-hmm. Yeah.
Right. And well, like some of the ladies in my family, they constantly struggle with it too, but I don't.
Yeah.
So why? Right.
Yeah. So it turns out that that's not really true. That exposure does not make people sick. So somebody can go in a room, cough, and one person might get sick, but everybody else is exposed to that same bacteria but does not get sick. Yeah. And so it's not exposure to the bacteria, but it's more about the failure of the barriers to protect you against that bacteria. Okay.
Yeah. That's interesting, because I was thinking that older women struggle with this, and don't they? I'm asking too. Yeah. But then also, don't they struggle with the dryness and the mucosal lining and the estrogen dominance? Right. Yeah. So that could also be a creator. Yeah. So you have several different ways that you prevent this from happening, right? Is one, the vagina is supposed to be acidic. And so it's supposed to be a certain pH of acid that then is inhospitable to butt bacteria. So it shouldn't even go in there and survive anyways, right? It should be like, oh my God, it's too acidic, and it dies. I'm out of here. Right? Yeah. So, kind of like the stomach, too, with the acid. Yeah.
It's like the stomach of the vagina. So the bacteria shouldn't even survive in there. The urethra should be slightly acidic, and so that's there. And then you also have the mucus, which is what you were talking about.
Yes.
Right? So again, just like we have snot from going all down, capturing all these bacteria, you should have mucus just being made and just drooling down, and any kind of bacteria, virus in there gets stuck in that mucus, and then it just sloughs off. And
does anybody remember how many cups? We talked about it earlier. If you do, type it in. Type it in. How many cups of mucus are you supposed to have?
In the vagina?
In the body.
Yeah, so
in the body.
Someone needs, I don't know the answer for the vagina one.
No, for the body.
No.
10 cups for the body.
10 cups for the
I just gave it away.
Damn it. Thanks a lot, Obama.
Talk's over. Sorry, folks. Okay, go on.
So, alright, so mucus or snot in the vagina, right? So, it's supposed to constantly do that. And that's where, like, some people complain if they have, like, a little bit of secretions in their panties, right? Or the brown stuff. But that's all good. That's actually really good, right? Because it's supposed to be doing that. And so mucus, a couple things about that, is one, you have to be overhydrated. Now, typically women are going to have more UTIs, also because they tend to drink a lot less than men. And so they're less hydrated, and the blood is going to prevent...
He's not talking about alcohol.
Yeah.
Even though that's true, too.
Masagua.
Okay.
So women tend to shrink 2 to 4 inches between the ages of 40 and 60, and that's because of dehydration. Every little joint space in their body starts to become dehydrated, and they actually lose vertical length. So, part of that stilling of mucus, they get the dry skin, the dry nasal, the dry mouth, but also the mucus then starts to dry up in the vagina. And then you don't capture those guys in those little E. coli's in the vaginal lining, and then they are allowed to grow and prosper in there, right? So that's the second one. And then the third one is you're supposed to be full of really good, dense, good bacteria in the vagina. So the vagina has a very special set of bacteria that live in there, and they don't like E. coli, so they don't let them live there. Kind of like probiotic racism. That's, yeah. The vagina should be more hospitable to other bacteria and yeast, actually.
If it had good manners. I
know, that's more like, we're all just microbes.
We're all just trying to get along.
Right? Oh, man. Vagina is so hostile, right? So, that hostile vagina bacteria is coated in there and plentiful. So if those bacteria then are killed by soaps and douching and that kind of stuff, then it's not there. So that's where women can use, they can douche with apple cider vinegar, they can douche with kombucha. I get the mango, that's the best one. Probably not.
Internally, take probiotics.
Yeah, but the way you get vaginal bacteria is from the gut.
Okay.
So you take it oral, and then it has to go across. But you're trying to get in there before the bacteria.
Okay.
From the butt.
It's better to just attack directly. Okay.
Right. So if you're having chronic UTIs, then you want to flush the vagina with lots and lots of good bacteria. So used to, back in the day, they do yogurt, right? Which is, that seems like a horrible piñata. But that's only got one bacteria in there. That's acidophilus. That's not doing anything. So you want to get, we've had people take those pearls, crush them up, and then put them in the water, and then douche with that, and so then it inoculates there. Or there's little things that you can put up there. Or there's special probiotics. Like if you got a vaginal blend, you'd want to put it in intravaginally. You wouldn't really want to take it orally like they suggest.
Okay. So somebody made a comment about D-mannose working for UTIs, Hospit E. coli.
Yeah.
That was Tambra. All
right, so...
thank you, Tambra.
D-mannose. Okay, so we'll get to that one. We'll wait.
Okay.
We got one last thing.
Okay.
And that is drinking a hell of a lot of extra water, so you just constantly flush out the bacteria out of the urethra, so you don't get UTIs.
Okay.
So you think of like a water faucet. If it's constantly peeing, nothing can go up in there and really cause much trouble because it would just get flushed down.
What about cranberry? Everybody and their dog talks about cranberry.
Yeah. So cranberry is one of those things that actually prevents the bacteria from sticking to the sides of the urethra and to the cyst wall or the bladder wall, and so that way when you overconsume water, it flushes it out.
Okay.
So it's a good adjunct for sure, and of course cranberries are awesome by themselves. You should just eat cranberries.
Okay.
You can make a cranberry nut puree that's awesome.
Okay.
So then you need to go back to like things like D-mannose. So D-mannose is a very common thing for that, and D-mannose is actually a glyconutrient that stimulates arabidinoglycan activity, which is like how Tamiflu works. And instead of using shikatinic acid from the bark of a tree, they use mannose as a product. So that's a great one. That's really good, and it's a very simple one you can get over at any health food store. Uva ursi is more the aggressive one. So uva ursi, UTI you think bacteria, upper respiratory you think viral. So uva ursi, golden seal, those are always really good ones for boosting the immune system against against infective bacteria in the urine.
Yeah, Tambra's saying she says from her understanding, it's the sugar extract from cranberry that's what D-mannose is.
Mm-hmm. Well,
Okay.
D-mannose in a lot of stuff, but
Okay.
yeah, that's exactly true.
Okay.
Yeah.
Okay. Great. Okay.
Uh-oh.
So.
Hastings posted a whole bunch.
Uh-oh. That's a good thing.
She said,
Oh,
Dr. Garrett's a big
She
fat
says,
liar.
"Ladies, he knows what he is talking
Oh,
about."
I like her.
Dr. G, help me out.
She's one of my favorite people then.
Brianna, you've just gained points. Yeah, so thank you for this nice post. She had chronic UTIs every 6 to 8 weeks. And that was probiotic racism, she says.
That's
Once
right.
she stopped soaping and started rinsing.
Oh, yeah.
Yeah, so.
So, and that's true too. Is never use soap on the vagina at all. You only want to use water because you want to keep all those good bacteria there. And so only wash your stinky bits, which is maybe the bottom, your feet and armpits, but really don't wash anything else with soap because you want to keep all those good bacteria intact so you don't get infections.
Tammy's asking, can you use the same remedies for UTI if you're pregnant?
Ooh, that's a good question. So, I would have to look that up. Let me see. So, I'll look up uva ursi just to see. So some of those things have caution. So if you do like cranberries, absolutely that won't be a problem at all. If you do vitamin C, that's not going to be a problem at all. But something that's a very potent one like uva ursi,
Best to check it out. And we can also answer this too. We can address it too after the talk if we can't get to it right now.
Oh, here we are. Okay, so uva ursi, I want to look this up because that's a good question.
Yeah, if anybody else has any burning questions or
Like a UTI?
or literal burning, figurative or literal burning, let us know what those are.
Okay.
We're trying to address the things that you guys are concerned about, so even if it's very common, let us know.
So on that one, it has just the standard recommendation of take it under physician's care and use extreme caution with herbs if you're pregnant or lactating. And basically that means you just need someone else to look it up. So if you post it, if you're serious about that, I can look that up and research it out. But you might want to just use a absolute safe one.
Well, water's not going to hurt anything, and like you said, and probiotics shouldn't either.
Yeah, that'd be awesome.
Yeah.
The first inoculation of the baby to get its own gut bacteria is through the vagina. So you want that vagina when you're pregnant to be just coated with all kinds of bacteria, and then it slides down like this, the baby, and then it inoculates all that with vaginal bacteria.
And that might be all you need.
That's right.
So it wouldn't hurt to start with the things you know are safe.
So here's a thought.
Yes.
All right. So they did this study where this guy had only right ear infection. It was part of the microbiome experiment or project. So the guy only got ear infections on one side, but not the other, right? So equally, they should be exposed to the same bacteria or the same infections, and so they couldn't figure out why he kept getting it. So one of the theories was maybe his one ear, the right ear, didn't have enough good bacteria in there to fight off any kind of bacterial infections. So they took the good ear, swabbed it, and put it in the other ear and coated it so it could inoculate both ears with the same bacteria. And the guy, the ear infections went away, right? Mm-hmm. So one of the new things that they do is they do poop transplants, right? Mm-hmm. So they take someone else's poop and then they put it into a capsule, and then you eat that pill, or they stuff it up, and then you get inoculated with their gut bacteria. So the next burgeoning miracle is going to be vaginal bacterial transplants.
Oh, probably. Yeah.
So,
right.
Yeah.
So if you didn't think we were connected...
So find a friend that doesn't have UTIs.
And ask her for a sample.
Yeah. We can go into detail with that. It's more of a Cinemax After Dark kind of experience.
Right. If you weren't blushing before, you're blushing now.
Yeah, but that would work.
Yeah.
Right?
Yeah.
Maybe.
Science. It's science. So okay, so we talked about sinusitis. We talked about UTIs. Tambra's laughing. And then we also had someone who said eye infections.
Yeah.
Like I said, keep throwing those issues out. Those things you want to know about, we want to talk about. So let us know. Right. But can you speak on eye infections?
Yeah. So with eye infections, typically they're going to be viral, but they could be bacteria too. Like pink eye will be usually Haemophilus influenza aegypticus is one of the most common ones, which is a bacteria. But you can also have a viral conjunctivitis that's in there too that causes pink eye. So part of it is usually viral, doesn't have a lot of pus or anything, but bacterial would.
Okay.
So you can use colloidal silver, but again, only don't. We'll say under a doctor's care. You can put colloidal silver in your eye.
Directly?
Yeah.
Okay.
And so I think the recommendations say don't do that. But time to live on the edge. No. So only do it if your doctor's okay with you doing it and can monitor and rule out any kind of risk there. Make sure it's good quality, all that kind of stuff, before you start messing around. Theoretically, there should be zero risk at all with that. But again, I'm putting that caveat out there just because we're doing a lecture and not a consultation or something like that. So I've known people that have done that, and it worked beautifully. And then viral, usually it's just, again, back to the vitamin C, knocking down the inflammation, that kind of thing. So
I have a question.
Yes.
What about frankincense?
Oh, I wouldn't put frankincense in the eye.
I thought, well, he told me one time that you said it was safe enough. You wouldn't put it directly in the eye?
I said I wouldn't.
So.
Did you really put it in your eye?
I put it in my eye. I did put it in my eye.
It'll probably be okay.
I can see, so this is good. Yeah, this was months ago.
You should dip your contacts in it. Was I drinking that day?
Oh, no. You said, well, we talked about it being safe enough. A safe essential oil. Frankincense is a safe essential oil.
Yeah, I would do it.
I've accidentally gotten tea tree oil in my eye.
Did that burn?
No.
So I think, now again, this isn't me recommending stuff, but like I put a little bit on my finger once for a sty, and then put it like here, or put it like right here.
Yeah, that's what I was doing.
Yeah, that's what I do myself. But again, only under doctor's care, putting stuff in your eyes.
Are there eye flushes that you know of?
There are. I mean, you can buy those at health food store. Or
that you can create on your own?
Yeah.
Okay. Yeah. Maybe we can look those up too.
Yeah. And usually if you get, you can do saline flushes, that kind of stuff. You know, if you have congestion too, one of the wonderful things that I when I used to kind of get sick all the time is I like doing saline flushes. And I would take a cup of warm water in a glass, put about a teaspoon or tablespoon of salt in there, and just mix it up till it mixed really well, dissolved. And then I would put it up to my nose like this, and I would lean it back slowly until I could slowly just feel it trickle down the back of my throat. Mm-hmm. And then I would go and blow all that stuff out in the sink. And do that a couple times, and oh my God, everything was just like fresh and clean then. And then I'd take the last bit and I'd gargle it, I'd go like this, and try to get as low as I can without choking and dying. and gargle, 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 and then spit that out. It was like so much mucus and gross stuff that comes out.
It is important not to die.
Depends on your life insurance.
I did not hear what you were putting in that because I was focused on looking at the thing. But so what was that?
I put 1/4 meth and 1/4 heroin. No, just salt. Just I would do like.
You could do a neti pot too.
Well,
right?
I don't know about neti.
The neti pots are amazing. Has anybody done a neti pot?
You talk about neti pot.
I love my neti pot. My ears were popping for years. I didn't know why. Every time I swallow, they pop. And I think I've just had allergies I didn't know about. And every time I've had allergies or have gotten some sinus stuff, if I do something with the neti pot, it's so great. So you just rinse into one nostril and it comes out the other nostril.
Show the position.
You just have to make sure. You have to make sure that your face.
Pretend this is your neti pot.
Okay. No, when you do it, yeah, you have to make sure that you are totally to the side, just like this, perfectly. Because if your head is tipped up like this, you'll start swallowing it. So when you do the neti pot, you need to be to the side.
And then what?
And then it'll just drain out the other nostril.
What?
You never swallow it. You don't choke. It just drains out the other nostril if you're not too plugged up. And afterward, it is amazing, I'm telling you. Amazing. You see this body language? Amazing. Clears everything out. My ears clear.
Is that right?
Yeah.
But you don't, do you snort stuff out? Do you like blow your nose like?
Yeah, I mean you have residue. You'll have just residual water, but then you just blow it out and you're good to go. I'm surprised he didn't even like.
I know people with neti pots, but I've never used one myself because I just do the cup. I'm cheap. I don't know.
Yeah, I mean it doesn't have to be a neti pot, but it has a little spout that helps direct the water.
Can I use a teapot?
I don't know why not, but it's probably a lot. I think in the neti pot it's a specific amount that they
Can I
have
put
in
essential oils in there?
I don't know, can you?
Have you?
I've used saline. I played around with vinegar, and I want to talk about this. Yeah, that was tough. I want to talk about this during our allergy talk. That was intense, but it worked. It worked. My nose immediately stopped running. Immediately.
My refrigerator stopped running once. It was worse, though.
Thanks for the support on that. Anyway, so we're off topic. The neti pot's great, though.
All right,
I don't see that anybody else has tried it, but...
Get her...
Oh, we've got I don't like them. Tamara says Tammy loves hers.
So
Rachel, her husband loves it. See, there's other people who are doing it, too.
I do 2 neti pots at once, like that. And then by the time you get done, you're like, the prisoners are downstairs.
Yeah, so we've got some people giving us some feedback here on that. I have a question, though, from Rachel from before.
Yes.
She wanted to know the best thing for kids' ear infections.
Ooh. So, the Journal of Pediatrics, I think it's the British Journal of Pediatrics, said a long time ago, you don't treat ear infections. And so, of course, in America, let's give everybody antibiotics. So we just antibiotic it to death. So they said, in America, they said that I think it was the British Journal of Medicine, said that 60% of all antibiotics are given for the mom's comfort, not for the kid's comfort. Mm. And so it's just like, well, do something, it's my baby. I don't know, here, try this, right? So, really with ear infections, the most you want to do is just palliative care. The top of the membrane is loose. It's the something flaccida. And basically, if there's way too much pressure, it'll just pop on the top, and then that's where you get that drainage that comes out. But as that pressure builds up in there, it should hurt. And so you just use little warm olive oil drips down the ear. And so you just do that, drop warm olive oil down there. And then you put a little cotton ball in there. And that olive oil is the anti-inflammatory. If you used organic canola, that would be even better.
That's so funny because my mom used to do that when I was a kid. And then I went through this phase of, oh, that was an old wives' tale.
Right.
Yeah.
Yeah. So your mom wasn't tripping, man.
She wasn't tripping.
She was keeping it real.
Yeah.
So you could also put, like, if you want to get hardcore, you think it's actually bacterial, then you could put a little bit of garlic oil, a little bit of olive oil, and a little bit of frankincense mixed together. and you put it in your ear, and that'll knock down any infection there too.
Yeah.
And the reason you get ear infections is because, again, your ear is a sinus, or not your ear, but your mastoid air cells back here are sinuses, and so they got to make fluid, and the fluid goes past your ear, and then down the eustachian tube into your throat. So if you get any type of viral thing in your throat and it gets in that eustachian tube, it will swell, but it's the bone's on the outside, so it just swells in. Fluid starts building up, and then you get. Usually, most people's ear problems are not infections, but you can get infected if it's stagnant long enough. So the solution really is just palliative care and treat the throat, not the ear.
Yeah.
So I mean that's the standard, but nobody practices like that because you just want to make the mom happy using it.
Yeah.
Not me. Like suffer through it. I had to suffer through all my kids. You get suffer through. You got to earn that.
Parenting stripes. So we've talked about sinusitis, UTIs, eye infections.
Uh-huh.
We haven't really gotten to our general infections or types of infections. Is there anything? We've got 15 minutes. Is there anything you would like to cover or talk about?
So two things. What's the difference between a cold and a flu?
I always associate the flu with throwing up.
Okay. So this is funny.
Body aches.
I taught functional approaches to immunology too, and it's about infections. And so you have a room full of all these doctors, and I said the same thing. What's the difference between a flu and a cold?
I think of cold as respiratory, flu as stomach. Stomach flu is what I think of. Like, I don't know if that's scientific. Anybody else? Any other thoughts?
So sometimes it's like they say, well, if it's green mucus, it's a flu. If it's white mucus, it's a cold. If you have a fever, don't have a fever. What are you guys' thoughts?
Anybody else have any? How you think of it?
It's a trick question.
I know.
How do you know? You don't know.
Because you like to play a lot of tricks.
I do.
Yeah.
All right.
So fever and aches versus just respiratory, Brianna.
All right.
Okay, thank you, Brianna.
See, she's participating.
Yes.
So there is no difference.
Even if you're listening, just listening, that's okay too.
So there's
Stick
no
with
difference.
us.
A cold and a flu to the body is the same thing. Exact same thing.
What?
Yeah. They're both viral infections.
Right, but they're different types of viral infections, no?
So cold is any of the hundreds of viruses that are cold viruses. But flu gets its very own name because it's from the influenza virus. Or influenza virus.
Okay.
And so flu gets its own category because flu is the only one that killed millions of people.
Yeah.
So in 1812 or something like that, they killed a bunch of people. So that's the only reason we call them two different things. As one is actually caused by influenza and the other is caused by any number of other viruses.
Okay.
But to the body, they're exactly the same. And there's no way to tell the difference unless you do a viral load test or something like that.
Okay.
So, the one last thing we got to talk about is herpes of the face.
He's been dying for this one.
No, because we said we were going to talk about that.
We did.
Yeah.
We did 2 talks ago.
We got so many private Facebook posts that said, please talk about herpes. I'm suffering like crazy. No, we didn't. But I got lots of patients that have cold sores. So, all right. The herpes family is chickenpox, shingles, cytomegalovirus, which is pseudomonas, and then mono, which is Epstein-Barr virus. And then herpes simplex 1 and 2. All of those are from the herpes family, or herpes viridae, right? So all of them work the same way. And this is pretty cool. Because for those viruses, with the exception of chickenpox. Chickenpox is skin infection. Everything else is nerve infection. That's not true. All right. Herpes is a viral infection. Herpes and shingles is a neuroinfection. Chickenpox is a skin infection. Cytomegalovirus and Epstein-Barr are systemic infections.
Sometimes he has to go deep into the file room.
All right.
Okay.
So let me clarify that before I get in trouble. All right. But the way that like cold sores work is that they live in a little teratoid ganglion, Or shingles, they live in a little nerve ganglion in your back or side or something like that. And that's where they live. So you can't kill them without killing the nerve. And when the immune system is suppressed, either by sugar, stress, antibiotics, in-laws, whatever, then it starts breeding in there like crazy. All these little herpes viruses, they grow like crazy. And they use an amino acid called arginine to do that. And arginine is what dudes take to try to get erections because it increases blood flow. It's also what people do to lower hypertension because it makes nitrous oxide, which then increases blood flow, so then it brings down blood pressure. But oddly enough, it increases pressure other places. So then arginine will help them breed. Arginine diet is lots of nuts and meat. And then...
or supplement.
Or supplements, yeah. So then lysine... Or sorry, let's do this. So then they build up and they go up and up and up the nerve, and then they start to come out here or here or here, right? And people will feel a little bit of tingle because it's starting to break through the skin, and that causes a nerve impulse that says, ouch, this hurts, and people will feel it long before it erupts, right? So then it erupts, and then it spreads all that herpes virus everywhere else to try to get a whole face is what it's trying to do, right?
Okay.
And then you spread it around to all your friends and family. And the way that you fix that, though, is long-term, address the why is your immune system suppressed kind of thing. Mm-hmm. So, sugar and stress and chemicals. But the short-term and the easy solution for a lot of people for this is lysine. Because arginine and lysine balance each other out. So if arginine's high, you take lysine, make it high, and then arginine goes down. And you suppress that viral ability to make a strong enough viral load for it. Mm-hmm. So, that being said, you can just take cheap lysine over the counter, like 500 milligrams for prevention, or like 3,000 if you feel like... So I tell patients, if you feel like a little tingle, take a whole bunch of that stuff. If you take way too much, you'll get diarrhea. Then you probably lose a little weight too, so that'll be great.
I have a quick question for you. Actually, Brianna does.
What?
If shingles is nerve and chickenpox is skin, why are they connected?
Yeah, because your skin's connected to your nerves.
Okay.
No. Okay.
But don't change.
So a chickenpox infection's on the skin, but on the skin you have nerve endings, free nerve endings. And if that virus infects that nerve, then it goes down and it goes all the way to your very back, and it lives in that ganglion. And then at some point when you get old enough and stressed out enough, then it erupts back and becomes shingles. So it's just a way that it moved from skin to nerve with that virus.
Now, the lysine, let's say you have one of these things in the family, shingles, or you've got herpes simplex 1 or herpes simplex 2, or you've got whatever you're struggling with. Is the lysine, is that your answer?
Right, yeah.
That is the answer.
Yeah, it's good. You can't kill it, but you can knock it out and not have it anymore. So when I was a kid, my mom had cold sores all the time, and she went to a chiropractor and he said, just take lysine. And now she didn't have them anymore.
I mean, it's not it still lies dormant, though, right?
Well, so again, long term, if you're eating healthy and taking care of yourself, you really shouldn't have a diminished immune system to where they'll come back out. So it'll be only really extreme times that person may have to take lysine. But otherwise, a lysine-rich diet is lots of fruits and vegetables and fish. And amazingly, that's the diet of the healthiest, happiest populations on Earth. But it's also the diet of people who don't want to have constant herpes. Now, I did read, I saw a commercial. I think it said 1 out of 5 people have genital herpes, right?
Hey.
So...
Yes, Brianna, the answer is yes. Sorry, I'm interrupting you, but it's only because we've got all these great questions.
What?
Brianna, so she said, so you can take lysine for shingles.
Right.
Yeah.
Oh, yeah.
Yes.
And you want to take really high dose for that. And shingles is contagious if you haven't had chickenpox.
Okay.
Yeah.
Okay.
All right. So, I forgot.
I'm so sorry.
All right. No, so I saw that, I think it was a commercial that said 1 in 5 people have type 2, herpes simplex 2, which is the genital herpes, right?
Yeah.
So, like, they should be distributing, instead of ecstasy, they should be giving lysine pills at the clubs. What about that? Or Molly mixed with lysine.
Okay,
Uh-oh.
we'll fix that.
Yeah, you just gotta click.
There we
you
go. Okay.
So yeah, so lysine is awesome, and otherwise, you want to kind of keep it in your natural medicine cabinet, but otherwise, you shouldn't have those anymore, whether it's face or otherwise.
A couple of people are saying they've had good luck with tea tree oil, melaleuca or tea tree oil as well on their cold sores.
Well, so that will help. So if someone does have a cold sore outbreak, they want to put the best things ever is lavender and frankincense. That'll knock down inflammation, and lavender is beautiful because it won't get all crusty or gross or anything.
Okay, lavender and frankincense for inflammation, lysine for reducing the infection itself.
Yeah.
Okay.
And lavender smells a lot better on your face probably than frankincense. Or sorry, tea tree.
Oil.
Yeah. You know how guys like the tea tree?
Melaleuca is a brand name of tea tree oil.
Melaleuca means
right?
tea tree.
Oh, it does?
Yeah.
Oh, I didn't know that.
Yeah.
Okay.
So a few other things. So before we finish here, I made a few lists of things. So like anti-mucus things, lemon. So that's why you put lemon in your tea, is to cut down on mucus and thin it out.
Okay.
Ginger, and one of my favorite things ever is taking an organic lemon, pureeing that with a little bit of water, and about a finger's length of ginger, or let's see, if you do about like 9 inches of ginger, that's about what you want, and then puree that up, and you make a ginger lemon paste. You didn't think that's funny? Come on, that was funny. All right, so you make a lemon ginger paste, and then you take that and put it in the fridge in a mason jar, and then I do like a tablespoon in water, and that's awesome, right? But it also, if you're sick, like that'll knock down pain and inflammation like crazy, but both those lemon and gingers are also anti-mucolytic, so if you have excess mucus production, it'll help clear that up a little bit. And then you can throw a little cayenne in there, or do a little wasabi, and that'll flush all that stuff out. So if you have sinus congestion, eat like a little pea size of wasabi or horseradish, and that will just flush all that stuff out really fast. And there's the Master Flush, which, no, that's not right. Master Flush? What's that called? Master Cleanse. Then my joke doesn't even work out here. Dang it. Yeah, the Master...
He had a
I wrote a joke down.
So it was supposed to be Master Flush versus Dr. G's Grand Master Flush. Anyway, for those of you who get that, I wanted to share.
That's old school. So Master Cleanse, that doesn't work.
Grand Master Cleanse. Okay.
All right.
Okay.
Maybe that works. But the flash versus flush, that's better.
Yeah.
So some people do the Master Cleanse, which is like a water with a little bit of lemon in there and cayenne, but you still throw ginger in there too. But if you do that puree, it'll be kick butt. It's way stronger. That's the Grand Master Cleanse, yo.
Okay.
All right. Bad joke. Fine. Antibacterials, honey. They actually use honey Band-Aids now because of drug resistance.
Really?
Yep. And so there's special kind of expensive honey you can use, but really, honey does not go bad. So even like when they find honey in the pyramids, they could eat it. It doesn't go bad at all.
Yeah.
Yeah. And then one thing I learned today was with a patient was grapefruit seed extract, or you can eat the grapefruit seeds.
Okay.
That is antiviral, antibacterial, and anti-yeast. So you can buy it as a supplement. It's dirt cheap. It's like $8 a bottle. So that's a great one in the natural medicine cabinet.
Yeah.
Essential oils, we usually get lots of questions about that. There's a lot of hype, like, they cure everything, but that's not really true. But they do have strong medical research for those.
I use them constantly.
Yeah.
Yeah.
So garlic oil is a very potent one that you should have on hand. So that's a great antibacterial one. Thymol, again, it's the same thing as far as how it works. Same thing with basil oil. Those are all very powerful antibiotics. and they're also part of marinara sauce. And then eucalyptus oil, lemongrass, and tea tree oil mixed together are more effective against drug-resistant bacteria than chlorhexidine, which is what they use in hospitals. And this mix, I actually solved the case of the blue girl.
Yeah.
So.
Yeah. No, that's powerful. I've had amazing effects with that too.
She's brushing off the blue girl.
The blue girl story. We don't have a lot of time for the blue girl story, but stay tuned. Maybe we can talk about the blue girl story.
Nobody cares about the blue girl.
If you
Nobody cares.
Does anybody remember the blue girl story? I think we've talked about it.
All right.
Okay.
So then there's stuff to keep in the fridge. So apple cider vinegar or kombucha, constantly inoculating with good bacteria. The vast majority of all the good bacteria will kill all the bad bacteria, so you don't have to kill the bad bacteria. If you get sick, it's because of barrier problem, not because of exposure to bacteria. Okay. So that means amp up your natural barriers. So don't wash your skin with soap as much as possible so you have a nice oil and bacteria, so that way you can't get infected. One thing when I go hiking, I try to find sage. And so if I get scratched, which I do because I go off trail, I'll just take sage and I'll just rub it on there, on the trail. And no infections, no redness, nothing. It's beautiful. It's awesome. Pain, so in burns. If you have burns, the best thing in the world is to put lavender on there. And lavender is a natural antibiotic, and it actually stimulates cells to grow faster, and it's pretty awesome. Like, I literally was so amazed by it. I took pictures of when I had a blister, and its healing process. It was the most fascinating wound I've ever seen, versus what I've always seen before, where it gets all crusty and gross and oozy.
Yeah, we talked a little bit about burns in the last talk a couple of weeks ago, too. We had a talk on pain.
Yeah.
So if you did not get to see that talk and you're struggling with pain, acute or chronic, check that talk out. The talk right before this one.
Yeah. And clove oil is great for pain. Clove oil is really, really good. It's as effective as benzocaine from a study done at the Journal of Dentistry. And what else? So we covered a lot of these. Yeast infections, same kind of thing.
Yeast infections could be similar to UTI.
Right, yeah. And so that's caprylic acid that gets rid of that. That's also found in coconut oil. But really, yeast is supposed to be in your gut, or at least it's normally found in your gut, and even probably in your vaginal area, and of course on your skin. It's only when you kill off the good bacteria that yeast then proliferates and takes over. And then you have yeast infections.
But you could try probiotic or apple cider vinegar for either UTI or probiotic.
Oh, absolutely. Yeah.
And just try that, see if that works, and then maybe go to the other stuff if you still have trouble.
Right, because there's lots and lots and lots and lots of different options you can use.
So we talked about colds and flu a little bit. We talked about fever blisters. We talked about respiratory stuff. We did not talk about warts or toenails. We had that on the agenda.
Warty toenails.
How about cuts and wounds? So it's very, 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 very common.
Yeah.
Throw something out on that.
So I usually use tea tree oil or lavender oil.
Okay.
Yeah. Very simple. Just it takes care of it. So
okay.
If you ever get like out in the mountains and you get like something torn open, you can pack it with sugar, and then you're good too.
Or honey.
Or honey, yeah.
Sugar. That's interesting.
Yeah, that's old school. That's Civil War I kind of stuff.
So I think we've covered almost everything except for I think we didn't get to parasites and food poisoning.
No, we could do that later.
Yeah. We yes, that was going to be one of our talks. So our theme this month is home remedies, and we started with pain, and today has infections. Next week, we want to do allergies. I know I am struggling.
Nobody has allergies.
We are
No.
number one in Wichita, Kansas. Probably, I don't know if we are number one this year, but I know we've been number one in the past for the most sufferers of allergies, or at least the most allergens in the air.
Yeah.
So
I recommended ground ivy today for that.
You did?
First time ever. But that's the number one supplement sold in Germany for allergies. And I think I eat them. I thought there was something else, but me and my girls go around the neighborhood and we eat like certain weeds that are healthy for us, like dandelions and stuff.
Uh-huh.
And I've been eating these things, and I thought it was chicory, but apparently I think it's actually, what was I talking about? The other thing.
We're going to talk about it next week because it's about allergies.
Yeah.
So next
Oh,
week.
ground ivy. I thought it was ground ivy.
Okay. Next week, allergies. The week after that, we're doing sleep. And then if you're good and you're participating and you're just...
We're going to do Yo Girl.
We're not going to do Yo Girl. We might do digestion.
Ooh.
Home remedies for digestion.
Nobody has digestion problems.
Rachel, I see your post here about warts. Maybe Dr. G can... I don't know if you could address that quickly or if you want to address that after the talk.
Yeah, so real quickly, put coconut oil around it and put apple cider vinegar on it, a little dab it every day, and it should dry it up and get rid of it. You can also use tea tree oil or a combination of those, but that's worked pretty good for most patients.
Excellent.
Yeah, and the old school way is you take a little piece of duct tape, put it on the wart, put a Band-Aid over it, and then in a few weeks it turns black and falls off and it's nasty.
Why? Why does that work?
Nobody knows. Nobody knows.
Cuts off the air supply or something?
No, it's just some chemical in the duct tape. That's probably why kidnapped people never get warts.
Have you studied that? Are there studies on that?
You know how to get, if they duct tape your hands, how to get out of them?
No.
You go like this, like that, and it'll rip through it.
Thank you.
We should do it.
You learn something new every day.
We should do Yo Girl and then duct tape.
Okay.
All right.
All right.
Thanks, you guys.
Thanks for joining us. Please join us next week and throw out any more questions that you have now or even during the week.
Yeah.
And Dr. Garrett will try to address those. Give this guy a call if you've got something you really need to speak to him individually about. Or Facebook message him because he's your guy.
Well, thank you. All right. Well, I look forward to talking to you guys again.
All right.
Next
Thanks.
week. No, don't push that button though.
Don't tell me what to do.
No, not that.
Don't
one.
tell me what to do.